Hello everyone. This is Claire from Let's Speak by Insight OET. I'm here with an OET speaking roleplay for nurses. Watch the video completely. Here's the roleplay card. You have 3 minutes for preparation. After that, you can do the roleplay with us. At the end of the video, you can get our version of the full conversation. So start preparing.
Your preparation time is over. Now let's speak. We'll play the interlocutor's part of the conversation. And you can add the nurse's part accordingly. Don't worry if you can't catch up or manage time. You'll be able to do that with practice. And at the end of this video, we'll provide you a full version of this conversation. So, let's speak. Good afternoon. Nurse, I'm not feeling myself anymore. I don't know what's happening. I'm really in need of some help. Could you help me? I'm extremely tired these days, and I can't stand for quite a long time, because I feel like I'm falling down, and then I'm crying without any reason. I don't know what's happening to me. Yes, nurse. My name is John, and I am 40 years old. Go ahead, nurse. Why not? Here they are. No problem. Nurse, I don't feel like eating, and when I eat, I tend to put a lot of salt in it. I don't know why. Yes, I have some salt craving. My appetite is really low these days. Yes, I lost about 10 kilograms in the past 6 months. No. Yes. 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 Yes, but are you sure I'll be able to lead a normal life like others, if I follow the medicines? Yes, nurse. Of course. Sure, nurse. No problem. Thank you, nurse.
I hope you performed well. So now listen to the full conversation.
From the question, we can learn that this is an unknown patient case. And in the background information, it's mentioned that the patient is a middle-aged man. So irrespective of the interlocutor's gender, we need to consider the patient as male. So listen to the conversation.
Good afternoon.
Good afternoon.
My name is Chris, the community health nurse on duty today in this community health center. How may I help you?
I'm not feeling myself anymore. I don't know what's happening. I'm really in need of some help. Could you help me?
I can see that something is really bothering you. But please don't worry. I'll definitely help you, as you've come to the right place. So could you please be more specific about your problems, so that I can offer you the solution for that?
I'm extremely tired these days, and I can't stand for quite a long time, because I feel like I'm falling down, and then I'm crying without any reason. I don't know what's happening to me.
It's really hard to hear that you have these problems. But try not to worry, I'll help you to manage these issues. But before proceeding to that, please sit here. Are you comfortable?
Yes, nurse.
Now could you please tell me your name and age, for the purpose of documentation?
My name is John, and I am 40 years old.
Thank you, Mr. John. Now, in order to understand your condition in a better manner, I would like to examine you, may I?
Go ahead, nurse.
Thank you for allowing me. Thank you for the cooperation. From my examination, I can see that your blood pressure is really low. Maybe that's the reason why you were experiencing dizziness and tiredness. Besides that, there are some dark patches, or discoloration around your lips. So, could you please show me your knuckles, hands and knees?
Why not? Here they are.
Okay. Thank you. Well, I can see that these areas are discolored as well. So from these observations, I think that there must be an underlying cause for these problems. So, for a better understanding of that, I would like to ask you some questions. Would you mind, Mr. John?
No problem.
What type of food do you have regularly?
Nurse, I don't feel like eating, and when I eat, I tend to put a lot of salt in it. I don't know why.
So you have some kind of salt craving, I believe. Isn't it?
Yes, I have some salt craving.
Have you observed any change in your appetite?
My appetite is really low these days.
Did you experience any weight loss recently?
Yes, I lost about 10 kilograms in the past 6 months.
Oh, it's shocking to hear that. Anyway, thank you for all your answers. After having the conversation with you, and from my clinical experience, I suspect that you are having Addison's disease. Have you heard about this condition?
No.
Please don't be alarmed after hearing this term. It is an uncommon condition that happens when the body doesn't produce enough amount of certain hormone. And this is due to the partial or complete failure of the outer layer of the adrenal glands in the body. Is that clear to you?
Yes.
However, please don't panic on hearing this. Because even though it is an uncommon condition, it can be easily managed with appropriate treatment. So please don't be overly concerned about your health. Am I clear to you?
Yes.
So, for now, it is important that you undergo some investigations, such as cortisol and ACTH blood test, in order to confirm the exact reason for your problems. Because these tests will help us to understand whether enough amount of hormones are produced in your body. Is that clear to you?
Yes.
So for that, I strongly recommend you to consult our clinic doctor. Because the doctor will guide you regarding the blood investigations. And according to the results, if you have this condition, then you will be provided with the appropriate medical management. Is that clear to you?
Yes, but are you sure I'll be able to lead a normal life like others, if I follow the medicines?
Yes, John. I know you're really anxious. But please relax. I'm sure that you'll be able to lead an active and full life like others, if you follow the proper measures. Because, from my clinical experience, I have seen a few patients who had similar problems, and now they're leading a healthy life. Did you get me?
Yes, nurse.
So you are willing to consult the clinic doctor?
Of course.
That's great, John. I appreciate that decision. So kindly wait here, I'll make the necessary arrangements for you to be seen by the doctor. Probably, you'll be able to see the doctor within 15 minutes. Is that okay for you?
No problem.
Thank you for your cooperation. Meanwhile, if you have anything else to ask me, or if you need any assistance, please feel free to let me know that.
Sure, nurse.
Thank you for your patient listening.
Thank you, nurse.
I hope you understood the roleplay. Subscribe to Let's Speak by Insight OET for more OET speaking content. Thank you for watching.